Okay, hello. My name is Holly, and I will be doing a comprehensive physical assessment on you today. First, I'm going to provide a privacy with this curtain, and I'm going to do hand hygiene and put on some gloves. Could you please verify your name and date of birth for me, please?
Yes, Louise Foster, 829XX.
Excellent. Okay, great. So what I'm going to do today, like I said, is a comprehensive exam. And I'm going to first look at you, and your hair is nicely brushed. Your skin looks really good. You are well nourished. And looking down, you are well dressed. Excellent. Okay. First, we are going to look at your head. I'm going to look for any sort of lesions, pressure sores, bumps, breakouts, breakdown, lice, and I don't see anything like that. Okay, next I'm going to look at your ears for symmetry, and I'm looking to see if there is any bumps or masses, redness. Okay. Do you have any pain in your ears?
No.
Okay. Any redness? No.
No.
Are you feeling any pain today on a scale of from 0 to 10?
0.
Okay, great. Okay. Do you have, let me see if you have any drainage in your ears today. Let me just look. Okay, your ears look good. Let me look at this other one. Great, okay. Now I'm going to look at your eyes. I'm going to use my pen light to look at your eyes. I would like you to look right here at my nose. I'm going to see if your pupils can constrict, okay? Yeah. Looks great. Okay, great. Okay, now I'm going to look at your lower eyelids. I'm looking to see if the sclera is red or miscolored in any way. I'm going to look to see if there's any drainage in your ducts, and there is not. Okay, so what I'm going to have you do now is I'm going to have you look at me, and I'm going to have you follow my finger with just your eyes, okay? Great. I'm looking to see, I wouldn't actually say this to a patient, but what I am doing is I'm looking to see if her eyes start shaking, but they are not. Her eyes are strong, and they look great. Next, I'm going to look at her nose. I'm going to use my pen light to look up her nose. Could I please have you? And for any drainage, and she does not have any drainage. Her nose looks great. No deviated septum. Her nose looks clear. Okay, next I'm going to look in her mouth. Okay, I'm going to say ah. Okay, and I'm going to look inside. Yeah, the color is correct. The back of her mouth looks good. I'm looking at her, now I'm going to look at your teeth and to see, it looks like she has all of her original teeth. There's nothing missing, and she does not have dentures. Good work. Okay. Oh, let me look at also make sure I've got the right color. There's nothing swollen. Yeah, there's nothing swollen, no redness. Everything is as it should be, is normal. Okay. Now, I'm going to look down the midline of her neck to her trachea. And it looks good. Her neck looks good. I'm looking for lumps or masses. Anything that looks abnormal. Okay, I'm going to look for her jugular. If it's bounding, I'm going to have her turn one way. It is not bounding. I'm going to have her look the other way. Not bounding. I'm massage your carotid one side at a time, looking for lumps or masses. Now I'm going to do this side. Everything feels good. Okay, now I'm going to check her carotid artery, her pulses. Your pulse rate's a little fast. It's about 90. Is that average for you? Okay, well, that's okay. It's within normal range, so that's fine. Okay, great. Okay, now we are going to go down to your upper extremities. I'm going to look at your arms to make sure that there's no masses, lumps, anything abnormal. I'm looking for redness, streaking redness. Making sure your skin is okay. It's okay. All right, now I'm going to look at your hands and look at your capillary refill. I'm going to press down on her fingernails. Yeah, she does. She's got a capillary refill of less than 2 seconds. Excellent. I'm going to look at your other arm. Make sure that there's no bumps or masses. And I'll check the capillary refill on this side. You know, I'm going to turn on the light real quick. I'll be right back. Here it goes. Now I can see it way better. Oh, it's fast. Your capillary refill is really fast. Oh, that's good. You have good circulation. Now, I will note that she has a diagnosis of congestive heart failure, and she is seeing a doctor at this time. So, next we're going to do her brachial pulse. Oh, I got 72 on down here, so that's unusual. Okay, now I'm going to check it over here. Okay. It's okay to have it different rates in
Well,
different
I also
areas.
have a pacemaker, but I don't
Oh,
know.
that might affect it,
No, I
sure.
don't know.
Yeah, sure it might. Okay, so I'm going to give you a Glasgow score of 15 because your eyes are open spontaneously, your motor function, you obey commands, and your verbal skills are excellent, okay?
Mhm.
So you're doing wonderful.
Thank you.
Now, I am going to listen to your heart. Okay. So first, all right. So first, I'm going to listen over here on your sacral, your second intercostal on the right side. Okay. Okay. Hold on, I'm just going to get in here, and it's right here. Hold on 1 second, I'll be right back. Okay. All right. I'm sorry. Here we go. Now we can do better. We're going to go down the sternum. Okay, so here's the aortic. Okay, then the second on this side is the pulmonic. Okay, it's stronger here. The aortic was not even palpable. This I'm going to put +1. We're going to go down to Erb's point now, the third intercostal on the left side. Okay, this is much stronger.
I've also had an ablation.
What's that?
I've also had an ablation.
Yeah, that could affect it too. You have had an ablation. It definitely could affect it. That could be why I can't
Yeah,
hear the aortic.
I think so too.
Yeah. Okay, then I'm going to go down to your tricuspid, which is the fourth intercostal right here. Yeah, I can hear it much better right here.
Mhm.
I've even put a +2 at normal here. Yeah, it's much better. Okay, now I'm going to go under here. This is the apical mitral pulse, the fifth intercostal. Oh. Let's see. I'm sorry. It's barely there. We put it at a +1. Goes blue, 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 blue. Yeah. It's blue, 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 blue.
Well, I've been told I have a heart murmur as well.
Really? This one is 75. Okay. All right, so next, I'm gonna have you sit up on the edge of the bed. Okay. All right, and I'm gonna listen to your back. Okay. Okay. All right. And just take regular breaths. Hmm. Great. Can I have you turn that way, Mom? Is it possible for you to sit on the bed and turn that way towards the camera?
You mean,
Just sit on the bed and
is
turn
it
towards the
sit on
camera.
the end of the bed, or?
Yeah, turn it to, well, no, that wouldn't work. Can you
Okay.
sit, can you just turn your leg towards the camera?
Okay.
Do you think you can? Maybe. I don't know if that's too much. Okay, like that. That's perfect. Thank you. Okay. All right. Okay, let's. There you go. Just for that. Okay. Here, let me just move the camera so that they can see better. That'll be easier on you. There we go. Okay, now they can see better. Okay. Here we go. Here we go. Is that too much? Here we go. You put it right here. That's too much, isn't it?
Well,
Here, let's sit you right here, and I'll put the camera over here.
I'm just saying.
That's too much for you. Just sit up, and I'll do it over here. You need to lay down a little bit. Okay. Up, up, up. This is a great video. Okay. There we go. No, that's not gonna work. Oh my gosh. Okay, there we go. There we go. Now you can sit. You can sit on the edge of the bed.
Okay.
That's a lot easier done for you. Okay, now we can do it here. Let's try this again. Okay. Actually, let's up here. There we go. And then 2. And 3. And 4. 4. And then 5. And 5. and 6 on this side. And you know what? I'm so sorry. Let me just listen to your heart one more time now that you're sitting up, okay? I think it might be a little bit easier. We're going to listen to the aortic. Let's just see if it's a little easier. No, I still can't get it. Let me try the pulmonic. Oh yeah, that's a lot better. Okay, now we'll try Erb's point there. Oh my, yes. And then we'll try the tricuspid. Oh no, that's a little bit more faint. And then we're going to try the atypical. I'm going to try your apical mitral valve. Oh wow. Now this is, I just said wow because it's my mom. I wouldn't say this if it was a patient. Oh, it is interesting though. That is interesting. Yeah. That is very interesting. There's like fluid around your heart. Okay. All right, you can go ahead and lay down for me. I'm going to put the camera back over here. Okay. We're gonna examine your abdomen now. Okay.
I also have atrial fibrillation.
What's that?
I also have atrial fibrillation.
Fibrillation?
Yep.
Okay, great. Now, I would like to know about your bowel movements. When was the last time you had one?
This morning.
Okay. And what is the consistency of your bowel movements? Are they firm? Do you
They're
have
less
diarrhea?
than firm and not diarrhea.
You have a little bit of loose bowel movements, okay?
Yeah.
Is that normal for you? That you normally have that? Okay.
I eat a lot of pineapple, a lot of grapes and apple,
Yeah, like
things like
fruit.
that.
You like a lot of fruit, okay. So, well, that's fine. And do you have abdominal pain normally, or?
No.
Okay, so you don't normally have tenderness or anything like
No.
that? Okay, great. I'm going to go ahead and I am going to palpate your tummy. I'm going to start over here on your lower right quadrant. And I'm just going to gently palpate it. We're going to go up here. I'm going to go over, just gently palpating it. Let me know if there's under tenderness.
Yeah, right here was real
There's
tender
tender
there.
right there.
Yeah, very.
Oh no. Okay. Have you seen a doctor about your?
I think it could be muscles from me getting up in the, at night I have to, in and out. And,
You've been getting up
the
at night?
muscles, I think is
Why
what
are
it
you
is.
getting up at night in or not? Okay. All right. So I'm not going to get right there, but I'm going to palpate a little bit harder, but not right there. Okay.
Okay.
All right. I'm looking for firmness and masses. Anything abnormal. Okay.
There's some pain here.
There's pain right there.
Yeah.
So your pain right here and pain right there, huh?
Mm-hmm.
And you think it's from getting up and down?
Well, I don't, whether it's muscles is what I'm saying. Could be sore muscles. I don't know.
Okay. Now I'm going to percuss it, so it's like this. Okay, I'm going to do this. Okay. Okay. I'm looking for rigidity. And you're making your tummy hard right now. Okay.
I have adhesions.
You have adhesions in your tummy?
Yeah, I have a C-section.
Oh, from your C-section. You had a C-section.
So there might be something hard, feeling there.
Okay.
Well, it's a scar tissue.
That's a scar tissue.
Mm-hmm.
All right, I'm gonna go ahead and listen to your tummy for. Oh, you've got plenty of good sounds in there. Yeah, I would say you would have a hyperactive stomach.
Well, I only had a pear and banana today, so it could be
Okay.
hunger.
Could be
You know, I could
hunger.
be hungry. I don't know.
Okay. Why have you only had a pear and a banana today? You've just not been hungry. You just haven't have been able to get you something to eat.
No,
Okay. I
Driven.
think I can help you out. All right, now I'm gonna have you just sit forward a little bit because I'm gonna look at your kidneys. Okay, I'm just gonna concuss your kidneys really quick. Okay, ready? Is there any pain or tenderness right in there?
No.
Okay. All right. Excellent. Okay. Now we're gonna look at you. Now I'm gonna have you lay back. Okay. I'm gonna look at your hips. Okay. All right. Let's see these. Have any pain in your hips?
Right there.
Right here?
Yeah.
That was painful?
Yeah.
Okay. Do you think it's from a lot of movement or?
I don't know.
Okay. Well, your hips are symmetrical. Okay. Do you have any pain in your legs?
Yeah, those soreness. I wouldn't call it
You have
pain.
soreness in your
Just
legs?
soreness.
Okay.
I think it's just muscle.
Just muscle pain?
That's what it feels like anyway.
I'm looking for any sort of lumps or irregular, abnormal type stuff. Okay, your legs seem fine. Your skin seems fine here. I'm gonna look down here on your lower limbs. Now the skin on your lower limbs, as we know, you definitely have edema. You have redness and a lot of dryness to your skin. You've had edema for quite a while because of your congestive heart failure, so we've known about it. There's a lot of redness, a lot of dryness down here. Because of the edema, there's a lot of liquid here. You're on Lasix for it. This has happened over a couple of years ago.
Well, now this only started a few weeks ago, and
Well, you've had redness for longer than
yeah,
that.
redness I've had, yes, but not this huge amount of peeling, dry skin.
Now down here, now are these varicose veins or what are they?
They come up occasionally.
They come up occasionally.
They're not on there
I've
all the
noticed you've
time.
got a lot of purpling right here. Is this redness or purpling, do you think? Is this modeling?
Yeah, I don't know.
I think this is just redness like this. This is just from your edema. Because you've got a lot of dry skin and redness.
Well, yeah, it's in poor circulation.
Yeah, poor circulation here. Now I'm looking here. I'm going to look at the bottoms of your feet. If you were a diabetic, you would have ulcers at the bottoms of your feet. Let me move this here so they can see where I'm going. Okay, there they go. Now they can. Okay, so I would look here for any sort of lesions or cuts or open sores or pressure sores on the backs of your legs, on your legs, ulcers. I'm going to look to see your capillary refill, so I'm going to press on your little toesies here. Yeah, you got good capillary refill. Well, actually, no. No, you've got, yeah, your capillary refill is pretty slow down here. Yeah, it's about 5 seconds. Yeah, holy cow. 2001, 2002,
where the
2003,
circulation is.
2004. You've got a 4-second capillary refill down here, so you've got some, you don't have the best circulatory down here. And your nails look good though. You need to, they're not thick, they're regular nails. Yeah, okay, so, what we're gonna do is we're going to do range of motion on you. In fact, let's do range of motion on your upper arms too. Let's do all range of
Do you
motion.
want me to?
So first, I want you to I want you to go up here and out. Okay, I want you to grab my fingers and squeeze hard.
Squeeze hard?
Yeah. Okay, now I want you to pull against me, and now push against me. Push against me. Push, 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 push. Oh, you're good. You're strong. Wow.
Mm-hmm.
Okay, now we're gonna do the same thing with your legs, okay? I want you to push against me. Push, push, push.
Oh.
Okay? Good. Now I want you to push your, go like this.
Okay.
Okay, go. Excellent, okay? Great. Now I'm gonna bend your knees up, but I don't wanna hurt you, okay? So we're just gonna, as much as you can go. Let's see what we can do. Okay. Let's do this one, okay? All right, so you've got some good range of motion here. Now we're gonna check your pedialis, pedis, dorsalis, pedis, pulse. And it's at the top. Okay. Dorsalis, pedis, pulse. I'm trying to find. There it is. It's very weak. I would say that +1. And I got 82 in this one. I'm gonna check it on this one. I got very weakly in this one. Oh no, God, oh yeah, there it goes. Oh, it's really good. This is I would say a +2 on this side. It's very good in this side. Very good. Look at you. It's stronger than mine. Wow. Okay, now we are going to come in here and we are going to do your posterior tibius pulse. Let's see if I can get it. It's on the inside of your ankle. Oh gosh, you've got a lot of edema here. Oh, I'm so sorry. Okay, it would be right here. She's got a lot of edema, so it's painful to her to do this, but this is where I would check it. And it's a little too painful for me to do, but it would be on the inside of her ankle, and I would do it on both sides. But it is non-palpable, palpable because it would cause her pain. I'm going to assess her edema now on her legs. Oh gosh, it's very painful. I do have the tape measure here. I'm going to press down here. Oh gosh, I'm so sorry, Mom.
Oh, I just didn't know it hurt that much before.
Oh wow.
You know, I never have done that before.
Okay, it is 6 centimeters. So I'm saying it is a 3+. She's got quite of edema. Okay, well, this was a very successful physical assessment that we have done today.
Thank you.
You so very much for your
you.
participation.
You did a great job.
And I hope you have a wonderful day. I'm going to take off my gloves, put them in the wastebasket, do hand hygiene, and pull back the privacy curtain. Thank you very much.